Hello dear students. Today we're going to talk about purine metabolism, hyperuricemia and gout. The aim of this lecture, at the end of this lecture, you should be able to correctly diagnose cases of acute or chronic gout. Objectives that will be covered in this lecture is, first of all, define gout and hyperuricemia, outline the causes of increased rate of urate formation, outline the causes of reduced rate excretion, review urate metabolism, state the danger of hyperuricemia, diagram an algorithmic representation for distinguishing secondary hyperuricemia, describe the diagnostic tools for acute gouty arthritis, outline other disorders of purine metabolism. The core clinical problems that are involved are acute joint pain and chronic joint pain, number 8 and number 23 respectively. You should go through your previous knowledge concerning metabolism of nucleic acids and the de novo salvage pathway. You could see it in previous lectures or you could see it in any other biochemical book. So, in definition, what is gout? Gout is a metabolic disorder of uric acid metabolism. It causes the deposition and accumulation of salts of uric acid in the joints, causing inflammation and pain in the small joints. This is a cross-sectional representation of joints with urate crystals. As you can see, they are deposited in the synovial fluid, and these will be very painful and during movement of the joint. Hyperuricemia may be asymptomatic. In other words, all gout is due to hyperuricemia, but not all hyperuricemia may cause gout. يعني في بعض الأحيان هو يعني hyperuricemia meaning the elevation of uric acid and uric acid salts in the blood. They might be deposited in the tissues or in the joints, or they might be not. So if there will be a precipitation or deposition, it will be symptomatic. But if not, so it be unsymptomatic. And sometimes they are associated with clinical syndromes of gout, or sometimes not. What are the main reasons for hyperuricemia? بمعنى, what are the factors that maybe contribute to hyperuricemia? Let's come to the sources of purines in the body. Where does purines come from? Purines are nitrogenous bases that are present in the nucleic acids. And so the main sources of purines are the RNAs and DNAs, which are nucleic acids, and the metabolism of these. And you know that nucleic acids are localized in the cells and the nucleus from its name. فإذا main source مالته هو it comes from metabolism of nucleic acids. What are the مثل ما قلنا إنه يعني هي منين تجي أصلاً؟ تجي either من synthesis of purines, de novo salvages. Also there we have dietary purines, which are presented in all types of meat. يعني هي حالة حال أي tissue، يعني كل ال cells consist of سواء كان animal cells كلها تحتوي على nucleic acids. mainly meat. tissue nucleic acids اللي طبعا هذه اللي تجي من ال recycling of nucleic acid from the tissue. كل هذه تؤدي إلى المين سورسز، كل هذه تؤدي إلى كلها يعني إلى البيورينز and السورسز of purines. طبعا اكو multiple steps involved. you could مثل ما قلنا تقدرون ترجعون إلى knowledge مالتكم previous knowledge بالmetabolism of nucleic acid leading to the formation of uric acid from purines. Now, a uric acid should be secreted mainly 75% of it from the kidney by excretion in urine. فإذا also another source of uric acid is either يعني الانتيك اكو زياده بالانتيك، زياده بالدايتري sources، زياده بالسيل تيرن اوفر من التشو، زياده بالسينثيسيس، or نقصان بالرينال excretion. يعني if there is something wrong with the kidney رح يصعد عندنا ايضا اليوريك acid because there is no or there will be a reduction in the excretion of uric acid from the body. 75% is excreted outside the body via urine, and intestinal uricolosis by bacteria 25%. Now, increased synthesis is due to impaired feedback control is probably the most important mechanism causing primary hyperuricemia, whereas abnormalities of other three steps are causes of secondary hyperuricemia. Mainly هي increased synthesis and cell turnover. يبقى أن secondary these are the primary hyperuricemia. Secondary hyperuricemia هي mainly kidneys. Causes of gout. Serum urate start rising mainly in male at puberty. خلوا بالكم إنه elevation is يعني in hyperuricemia mainly occurs in male. It seldomly adult male. خلينا يعني underline this, adult males. Children seldomly have hyperuricemia, and women also seldomly have hyperuricemia. Menopausal women شوية يزيد عندهم الانسيدنس مالت الهايبريوريسيميا، حالهم حال الميلز. فمعظم males during puberty, while women is only rarely rise after menopause. In some people, the rise is excessive. If the serum urate rise above 6.8 milligram per deciliter, tissues become saturated with the urate and then easily form crystals. This hyperuricemia is usually present for many years before the first attack, but not all people with hyperuricemia get acute gout. خلوا بالكم كل هذه الأسباب اللي احنا ذكرناها, all of these causes of gout and hyperuricemia, there should be a genetic predisposition, there should be a genetic anomaly, there should be something wrong with the genes that are involved with expression of the enzymes involved in the metabolism of purines. Otherwise, everything is going to be normal. بمعنى آخر إنه مو كل واحد takes have high intake of purines or dietary purines. ياكل كومة لحم مثلا، مو كل الناس تاكل كومة لحم راح يصير عندها gout، ولا كل الناس اللي تاكل كومة لحم راح يصير عندها hyperuricemia. There should be a genetic predisposition, there should be a disorder بالmetabolism of uric acid, of purines leading to uric acid. هذه خلوها ببالكم. There should be a metabolic disorder, and metabolic disorders are caused by a genetic abnormality. Okay. This hyperuricemia is usually present for many years مثل ما قلنا, but before the first attack, but not all people with hyperuricemia get acute gout. The reason for this till now is unknown. هذه شوية urate metabolism. This is just يعني شوية presentation عفوا يعني آسفة شوية ما طلعت صحيحة. you could يعني this is just a sheet showing a revision of urate metabolism. ما مطلوب من عندكم، بس هي يراويكم انه في نقطة معينة رح يصير عندنا how purine is converted into uric acid through xanthine and xanthine oxidase, and so if there is something wrong with the enzyme xanthine oxidase, this will cause يعني بالexpression مع xanthine oxidase this will cause disorder of purine metabolism. ان اليوريك اسيد هذا هو شكله، هذا هو الفورميشن مالته، and بالحقيقة هو يعني this is the uric acid and الملح مالته هو monosodium urate, and it's just like needle shaped crystals. فتشوفون مثل ما موجود عندكم بالصورة مثل needles, and imagine these needles are deposited in the cartridge and in the synovial fluid of a joint. يعني رح يصير عندنا مثل النيدلز، يعني هي بالضبط مثل النيدلز وتحتك بالجوينتس مالت يعني مالت العظم. ف this will cause يعني excessive pain definitely. acute pain يعني والاتاك رح يكون يعني على غفله، لانه رح يصير deposition اذا صار عندنا فد trigger يصير جدا عالي. What are the dangers of hyperuricemia? Urate is poorly soluble in plasma. Ionization of uric acid decreases as pH falls, and it therefore becomes less soluble at a urinary pH below about 6. Uric acid may form renal calculi. Urate precipitation at these sites cause an inflammatory response with leukocyte infiltration, and it's thought that lactic acid production by these cells cause a local fall in pH. So ايش راح يصير عندنا؟ ان اكو اشياء اللي تزيد من ال precipitation of and formation of monosodium urates in the joints and in the tissue. شن هي؟ كل ما كانت عندنا درجات الحرارة منخفضة كل ما زيدت من عملية البريسبيتيشن. فتشوفون دائما يصير البريسبيتيشن بالاكستريميتيز either بالهاندز and بالفوت mainly باللارج toe. فدائما تشوفون هذول جماعة عندهم gout أول شيء اللي يتأثر بهم هو التو and الجوينت بالتو. يعني هاي تشوفون هو الجاوت هو داء الملوك، فشوفون يصير عندهم التو inflamed enlarged due to hell deposition. قلنا إنه الcold temperature يزيد من ال precipitation of uric acid and uric salts بالjoints. فتشوفون دائما بالاكستريميتيز رح يصير عندنا لأنه due to less circulation. الشيء الثاني إنه during winter also يزيد بالمناطق الباردة also يزيد. بس مثل ما قلت لحضراتكم هي كل ما كان عندنا طبعا كل هاي الأسباب صح يعني these are risks، بس لكن لازم أهم شيء أكو فد genetic predisposition يلا تسبب هاي يلا هاي تسبب. يعني مو كل واحد يبرد رح يصير عنده gout، مو كل واحد ياكل لحم ويبرد رح يصير عنده gout، لازم عنده genetic predisposition يلا يصير عنده هذه المشاكل. الشيء الثاني اللي يساعد على البريسبيتيشن هو الأسيديك ميديا. أول ما يصير عندي triggering بالprecipitation of one crystal إيش رح يصير عندي؟ رح يصير عندي inflammation بهذا المكان. هالinflammation رح يسوي عندي leukocyte infiltration and production of lactic acid بالمنطقة localized بالمنطقة اللي يصير بها precipitation. فإيش رح يصير عندي؟ رح يصير عندي acidic media further acidic media and so further depositions، وندخل في vicious circle، ندخل في حلقة مفرغة. يعني كريستالاية واحدة صار عندي precipitation رح يسوي لي inflammation، رح يسوي لي production of lactate، رح يسوي لي lactic acid، رح يسوي لي further acidic media and so on and so forth. ندخل في vicious circle, a setup in which further precipitation and therefore further inflammation occurs. In acute attacks of gouty arthritis, local factors are more important than the plasma urate concentration, which is usually normal during attack. يعني ليش normal؟ لأنه صار بها deposition، بعد صار بها precipitation، يعني رح يقل اليوريت concentration بالبلد، يعني انه كلها راح يتركز بالجوينت او بالتشوز. يعني هو صار عندي hyperuricemia، اكو فد تريجر صار either cold weather, either high sodium, high meat intake or high purine intake, anything that will trigger precipitation. بس يصير عندي precipitation ايش راح يصير عندي؟ راح يقل عندي تركيزه بالبلاد، لانه هو كله حيترسب، بس يترسب راح يصير عندي acute attack of inflammation and pain. But during acute the onset of the inflammation يشوفون ان تركيز اليوريك acid is يعني normal. احنا قلنا precipitation is presented in the joints mainly، بس مو معناته it doesn't also يعني precipitates in the tissues. لا، الارثرايتس قصدي العفو gouty arthritis، يعني الجاوت may be due to precipitation of uric acid in the joints or also in the tissue. بالتشو يسموها توفيز. هاي التوفيز تكون يعني مثل يعني amorphous not crystals amorphous deposits. فالamorphous deposits ما يصير مثل الكريستالز مثل النيدل كريستالز، فشوفون هذه أخطر من الكريستالز. ليش؟ لأنه amorphous urates is not painful، فالشخص ما يحس عليه. يعني لما يصير عندي precipitation بالتشو، هاي التشو قد تكون either in vital organs such as the liver, such as the kidney, any vital organ. Precipitation of these might cause يعني might exceed the normal value، بحيث انه راح تأثر على الفانكشن مال هذا الأورجن أو مال هذا التشو الموجودة به. And this will be more dangerous than deposition in the joints, because in the joints they will be painful, it will have symptoms. بس لما تكون amorphous ما راح يصير عندي pain، ما راح يصير عندي symptoms يعني complain، وبالتالي راح يصير عندي further precipitation، يزيد البريسبيتيشن، يأثر على التشو، يأثر على الفانكشن مالته and maybe lead to failure of this function of this organ. So precipitation may occur in subcutaneous tissue, such as such deposits are called gouty tophies. A potentially serious effect of hyperuricemia is precipitation of urate in the kidney, causing progressive renal damage. For this reason, it has been recommended that even asymptomatic cases should be treated if the plasma urate concentration is consistently higher than 10. احنا قلنا بال6 تقريبا 6.8 راح يصير عندي deposition. إذا جاكم مريض وسويتوا له سكرينينج تيست ليوريك أسيد وشفتوه عالي، وبعدين قلت له روح يجوز مثلا ماكل باجة، ماكل لحم، ماكل لفة همبرجر أو لفتين مال همبرجر، ماكل ستيك، يقول له روحوا تعال باكر أو روحوا تعالوا بعد يعني فد يومين ثلاثة، وظلت persistency مالت الليفل مالت اليوريت عالي فوق 10، بس هو asymptomatic، يعني this case should be managed, should be treated in order to reduce the amount of urate in the blood, because this is a dangerous matter. قلنا أن we have two types of hyperuricemia, either primary اللي هو main source and primary و secondary. البرايمري طبعا لازم أكو عندنا familial incidence، يعني بمعنى آخر genetic predisposition. طبعا الsex and age incidence is very important. خلوا بالكم الميل دائما يعني هو most prone to يعني to have this abnormality. الفيميل less يعني والage also is very important. يعني seldomly occurs in children, mainly occurs in both sexes, بالmale and the female. Seldomly occurs in females in age يعني birth يعني at birth age يعني child bearing age اللي هو في الفترة اللي before menopause and بس يعني شوية يزيد الانسيدنس بالمينوبوز precipitating factors يعني هذه بالإضافة إلى precipitating factors. قلنا precipitating factors هي either تكون physical such as temperature cold temperature اللي حتزيد لي such as the pH low pH يزيد لي and also الدايت. الدايت خلينا نركز على شغلتين. الدايت هو mainly high purine intakes اللي high meat intake والالكحول. Neither these factors is likely to precipitate gout in a normal person. خلوها ببالكم. Biochemical defects in primary hyperuricemia. نيجي على primary mainly هو purine synthesis is increased in about 25% of cases of primary hyperuricemia due to overactivity of amidophosphorybosyl transferase which controls the formation of phosphoribosylamine in the de novo synthesis. Reduced renal tubular secretion of urate has also been demonstrated in other cases of primary hyperuricemia. Many subjects may have both increased synthesis and decreased excretion. Familial juvenile gouty nephropathy is a rare autosomal dominant condition leading to progressive renal failure. Now, احنا من الأول ذكرنا إنه يعني شغلة primary hyperuricemia seldomly occurs in children. مو معناتها it doesn't occur. عندنا حالات يصير بها يسموها familial juvenile gouty nephropathy and يعني this lead to progressive renal failure. نجي على secondary hyperuricemia. High plasma urate concentrations may be secondary to يعني either increased turnover of nucleic acid. Increased turnover of nucleic acid هي جاية من increased cell turnover. شو وقت يصير بها turnover؟ من يصير في الدامج معين. damage due to trauma, due to surgery, due to injury or due to cancer. يعني for example مثلا any cytotoxic drugs can be that يعني taken will lead to destruction of tissues, destruction of tumor هي high cytotoxic drug leading to increased turnover of tissues, increased turnover of nucleic acids and thus leading to increased urate metabolism. مثل ما قلنا rapid growing malignant tissue especially in leukemias, lymphomas, polycythemia, psoriasis when turnover of skin cells is increased following increased tissue breakdown after treatment of large malignant tumors by radiotherapy or cytotoxic drugs due to trauma, surgery, endogenous urate release is increased and during starvation. Other causes of secondary hyperuricemia is due to reduction of excretion of urate and this might be due to thiazide diuretics or يعني drugs or renal glomerular dysfunction. The rate of urate to creatinine concentration ratio in urine may help distinguish hyperuricemia due to reduced renal excretion from renal impairment secondary to hyperuricemia. So if the ratio was less than 0.7, this is due to renal impairment, and if the ratio was more than 0.7 suggests urate nephropathy. And this third reason is prolonged metabolic acidosis. Third reason for secondary hyperuricemia is combined يعني both increased production and decreased secretion due to either high alcohol intake, prolonged and severe exercise, dyslipidemia and impaired glucose tolerance of type 2 diabetes mellitus, and glucose 6-phosphate, I'm sorry for the يعني غلط المطبعي, glucose 6-phosphate deficiency or Van Gogh disease. Now, how do you make your diagnosis? هسه عرفنا الأسباب، عرفنا الفرق بين الهايبريوريسيميا وبين الجاوت، عرفنا الأسباب مالتها، عرفنا أنواعها البرايمري والسكندري وكل واحد وأسبابه. نجي هسه okay, what is the second step? You as a physician, what do you do? How can you make how can you confirm your diagnosis? The clinical criteria of gout should be suspected with patients with acute single joint involvement, particularly older adults or those with other risk factors. تشوف انت عندك الكلينيكال كرايتيريا مالتك، تشوف عندك الايج، السكس، اللوكيشن اوف الجوينت بين، single joint pain يعني مو multiple، فرأسا يجي بالك this might be a deposition of urate crystals. How to confirm your clinical diagnosis is a key from laboratory investigations. This could be confirmed by identifying needle-shaped, strongly negative birefringent urate crystals that are free in the fluid or engulfed by phagocytes, as you can see in this figure. The serum urate level is elevated, and when it is elevated, this supports the diagnosis of gout, but it's neither specific nor it is sensitive. If elevated, 24-hour urinary excretion, urate excretion can be also measured. Quantification of urinary uric acid can indicate whether hyperuricemia results from impaired excretion or increased production and help guide any serum urate lowering therapy. Patients with elevated urine excretion of urates are increased risk of urethritis اللي هي يعني formation of urate calculi. Also, for extreme measurements, you could go to the X-ray, and للإكس-راي للأفكتد joint رح تشوفون رأسا هاي formation of crystals taken to look for bony tophies, but are probably unnecessary if the diagnosis has been established. يعني ماكو داعي تعرض المريض إلى X-ray. إذا عندك clinical investigations combined with the laboratory results, you could confirm your diagnosis. الكرونيك جاوتي ارثرايتس هنا يعني إذا عندك البين is persistent and for single joint وعندنا also طلع عندنا elevated levels of urate and subcutaneous or body tophies. التريتمنت أول شيء you should control the pain. ثاني شيء نقلل من اليوريت concentration, preventing any complications of chronic gout, changing unhealthy lifestyles. يعني لازم ذاك الوقت diet should be controlled, يعني healthy diet should be taken into consideration, وطبعا وياها المانجمنت مال uric acid lowering drugs, any complications that might occur leading to damage to organ damages, and طبعا of course controlling the pain. Algorithmic representation for distinguishing secondary hyperuricemia from primary hyperuricemia. What do we have? عندنا عندنا مريض جانا hyperuricemia. نجي عاد شنو هي الفاكتورز that affect urate rising agents. عنده موجودة اللي هي الأسباب اللي هي for example مثلا الدايت, any other effect, for example tissue damage, cell turning, increase of cell turnover. فهذه كلها ناخذها into consideration. إذا ماكو نشوف أن measurement of urine excretion. إذا كان عندنا low معناتها السبب ما زيادة هو damage to the kidney, مدى يطلع لنا اليوريك أو اليوريك أسيد إلى الخارج, لأنه إحنا قلنا 75% هي من excretion مالته through via the urine in the kidney. فمعناتها أكو عندنا يجي بالنا impaired renal function. إذا سوينا renal function وطلع ما بيها شيء فنروح للmetabolic acidosis. إذا كان عندنا urate excretion is normal and الريت مالته is normal to high levels of يعني hyperuricemia, معناته there is evidence of high cell turnover. إذا نخليها ببالنا معناتها أكو فد malignancy، أكو فد trauma، أكو فد after يعني نجي ببالنا مثلا surgery، any damage to التشو. إذا لا معناتها نجي على الانزيماتيك effect. اكو شيء اسمه pseudo gout. pseudo gout هو همينه depositions of other types of salts but not crystals, not mono urate crystals, and these salts are calcium pyrophosphate dehydrates. They could be diagnosed by in the synovial fluid. You could see them under the microscope. It does not have needle shaped crystals. other crystals بس همينه وجود crystals بالsynovial fluid رح يسوي لنا pain. فهذه يعني يسموها pseudo gout. هل يوجد hypouricemia مثل ما عندنا hyperuricemia؟ يعني rare، عادة either due to management treatment of hyperuricemia or associated with proximal renal tubular damage in which reabsorption of urate is reduced and can be seen in Fanconi's syndrome. It's also at it is also at finding in some patients receiving parenteral nutrition and in pregnancy, the syndrome of inappropriate antidiuretic hormone also, and in type 1 diabetes mellitus. Xanthine this is another disorder of purine metabolism, not only hyperuricemia, very rare, but it is also a genetic disorder inherited as an autosomal هذه recessive disorder. Deficiency of xanthine oxidase in the liver. Plasma and urinary urate concentrations are very low. Increased xanthine excretion may lead to formation of xanthine stones. Note, this does not occur during treatment of gout with xanthine oxidase inhibitors. يعني هاي xanthinuria ما عندنا مشكلة بالديفكت because the drug also inhibit purine synthesis. هذه هي محاضرتنا مالها اليوم، أتمنى تكون واضحة. Any questions that you have, you can add them in the forum, and I could go back to them and review them and answer them. Thank you very much.